Hello everyone. Welcome and thank you for joining our first ever webinar for Pine River Institute. It's called Risky Business, Keeping Teens and Tweens on the Right Track. My name is Jennifer and I will be the moderator for this webinar. I'm an alumni PRI parent, the parent of a teenager who struggled with a lot of issues. I can tell you we tried every single thing that we could think of to try and help her, and she eventually went to Pine River Institute. Pine River Institute is an outdoor leadership and residential treatment program for youth between the ages of 13 and 19 who are struggling with addictive behaviors and often other mental health challenges. Pine River families learn alongside their child, participating in a parallel program about adolescent development, learning why the teen brain works the way that it works and how to better support a struggling child. I really wish that I had known some of this information that you will learn tonight earlier in our journey. It might have made a difference for our family. Pine River is a wonderful, wonderful facility for those that really need it. But the capacity is small and the wait list can be up to 200 youth at any given time. Our goal in this webinar is to give you the fundamentals on how the teen brain works and help you identify as early as you can what actually is risky business for teens, when you should be concerned, and how best to communicate with your child about this. Our speaker tonight is Dr. Victoria Creighton. She's a clinical psychologist with over 25 years experience in the field of adolescent development. She's the clinical director of Pine River Institute. At Pine River, Victoria guides the clinical work of a team of therapists who help the students there develop the critical life skills that they need to successfully mature and thrive in adulthood.
Thank you, Jennifer, and welcome. It's an honor to be here and great to hear that so many people signed up for the webinar. It always warms my heart when I hear about how committed parents are to actually helping their kids stay on track or get back on track. So why are we here tonight? First off, we're here because parenting is hard. It's something that we never get 100% right. And it's something we have to keep working at over and over again to do better. So I hope to cover three areas during our time together. First, I want to empower you to be a parent. Oftentimes in our society today, parents are often doubting their role and how important their role is. So I want to really give you permission to be a parent. Second, I want to teach a framework about how to understand what is going on in the adolescent development. And so when their behavior starts to cross the line, maybe there's some warning signs we should be paying attention to so that we have an idea what needs to be addressed in order to help a child mature. And then lastly, we're going to review some basic parenting skills that will help a child mature and grow. So, risky behavior. As you look at this list, you see drugs and alcohol, lying, stealing, sex, teen pregnancy. All these behaviors, I don't mean to scare you, but all these are signs of very scary, risky behavior, and they should be a warning sign for you. They're a child blinking, flashing yellow lights saying, hey, pay attention, I'm not on track and I need your help. So at Pine River, we work with kids that have drugs and alcohol issues, but we recognize that is just the tip of the iceberg. And underneath all that behavior is really a lack of maturity that they need to develop in order to succeed. So again, see these as warning signs and then learn how to address them. So the two assertions that I'm going to make tonight is first, the basis for adolescent difficulties is immaturity. And the second one is that there's something we can do about it and that we need to do about it. Parents play a huge part in developing their maturity in their adolescence. And this work, I want to attribute this model, this framework, it was developed by John McKinnon, who wrote a book, and we have references to that, the flawed approach, helping kids grow it up, how to change a mind. So Robert Keegan, he's a psychiatrist from Harvard, and he wrote the book In Over Your Heads. he recognized that young adults or adolescents, though they look like adults, they're operating from a very childish perspective. And those that struggle because they are operating from a very immature stance. And if they are going to grow up, they have to shift the way that they look at things. Age is just a number. He was one of the first persons to coin that term, and age does not equal maturity. How many of us know 40-year-olds or 50-year-olds that are not mature? At times I can slip in immaturity too. So if an adolescent or a teenager doesn't develop or mature psychologically, then we see a global collapse. That's where we'll see academic difficulties, social difficulties, and personal setbacks within their families and with their peer groups. So, and when you see the global collapse, you'll then gradually see the psychological symptoms to develop, such as using drugs or alcohol, or a lot of depression and anxiety. So why don't kids just adopt their parents' perspective of life? We wish it would be that easy. Okay, when kids are troubled, they don't know what is going on. They don't know what's wrong or why, and they often will develop a defense of they don't care. It's not a big deal. So when adolescents are struggling, it's not an intentional choice. They're not choosing to struggle. How many 5-year-olds want to grow up and become an alcoholic or a drug addict? They don't choose this. It's not a fact or skill to be learned. You can't give a recipe to a child to give them maturity. We wish it would be that easy, again, but it's not. And it's not willful bad behavior. And this was a concept I really had to learn when I first started working with adolescents. When I had an adolescent, one way to really trigger me is to lie to me. And so when an adolescent would lie to me, initially I would go, kind of get judgy and see them as bad. But after I learned this model, I was able to see that they were doing the best they could given the way the world appeared to them. They were operating from a very childish perspective. Immature adolescents may get it over time, but they may not. It will only change, their childish perspective will only change as they grow. So in short, it's not that unhappy teenagers won't accept good advice or refuse to make wise decisions. It is that given the way that the world appears to them, they can't. So if we look at the definition of what the word adolescence means, it's a young person in the process of developing from a child into adult. A young person who has undergone puberty, but who has not yet reached full maturity as a teenager. So it's a transition period. And as we all know, a transition period is often rocky. And if it's not rocky during the adolescence, wait till their 20s, in their 20s. So we will also talk about the developmental line. And this developmental line is really drawing on developmental theorists that have studied actually infant to adult behavior over the lifespan. And there's several theorists that will stand out to you. I'll often ask when I present this to an audience, how many people remember Psych 101? And several people will raise their hands, and you'll probably remember the names of Freud, Erikson, Piaget, Kohlberg. These are all people that we're drawing from to look at adolescent maturity. So what you can look at when we look at the developmental line is that each of the stages, if we look at an infant to the toddler, they're distinctive and they happen in order. You cannot crawl, you have to crawl before you can walk. You can't just start running. So they happen in order, they're distinctive. You don't mistake an infant for an adolescent, and they're dependent on one another. So we're going to go through several key concepts of maturity through this developmental line. The first one that we're going to talk about is thoughts. It's not, and this is where we're not looking at what a child thinks about, but how they think. If we look at an infant, their sense of thought is really not existent. They're all about sensory, motors, reflexes, nerves. So there's no thought going on. A toddler's thought is very, very loose. And we would call it magical thinking. This is a time when they believe in fairy tales, the tooth fairy, they'll believe in Santa Claus. It's just out there. Nothing is very concrete or grounded. A school child has very concrete logic and thinking process. Their categories are durable. They might have a stamp collection or a rock collection, and things fit their categories. And there's a story that can kind of show an example of this, and this is a story that's out there. I've heard it in several podcasts, but it's about a mother who was actually feeling compelled to tell her 6-year-old daughter that she was actually the tooth fairy. And this is when you can see the child actually still in the magical thinking, beginning to get concrete. And she goes, "Okay, Mom, you're the tooth fairy, but how do you get into all the other children's homes?" So still had the magical thinking, and not grasping the idea of concrete thought that Mom was actually giving the money. Just assumed Mom was a tooth fairy. So adolescence is actually when a child can get abstract thought. And this is really the crown jewel of thinking. Abstract thought is important for a couple reasons, because it's when you can think cross categories. And why is this important? If you were studying about integrity or loyalty or having a sense of a connection or a relationship with a parent, you're able to look at lying may impact my relationship with my mother or my father versus I know why I should not lie and I have a relationship with my mom. Abstract thought allows you to think cross categories. So that is what we're looking for with the maturity piece. The next one is time. Few things matter more than the concept of time, and this is the ability to make time, to manage time, make a goal, and set a plan to reach that goal. An infant, they are in the now. Okay, there is no future, no past. They are just right in the moment. And while that may be good and what we sometimes want to, it's not good if you're always in the now. So the toddler, because their thinking is magical, they are into like this never, never land. They don't really have a concept of time. If you say we're going to Disney World, they'll go in like 2 weeks. They don't know when that happens. But if you say we're going in 2 sleeps, maybe they will get that. But again, it's a hard concept for them. Really, the concept of time only happens with school children. And that's when they have clocks and calendars. And due to that, they can actually calculate time, and you can start to add delay gratification. So those are the things that we're working for. But what we're really hoping is with the adolescent is that they're able to have a realistic future based on what they're doing now, recognizing that their behavior now is going to impact their future. So if I have an adolescent that, I meet with them the first meeting at Pine River for our assessment, and I go, so where do you see yourself in a year? Often our kids will say, I have no idea. And so that would be infant stage, they're in the now, they're thinking when they're going to get their next drug. Or they might say, I want to be a doctor, yet they're not even attending school. So that's the magical thinking. So we're looking for where a child is able to say, hey, I'm going, I want to finish high school, I'm going off to university or going off to college, or I'm going to find a job, and then they have a plan of how they're going to get there. The next one is separateness in relationships. The lack of separateness in relationships is called puppet relationships. And this is when a parent and a child are fused in a relationship. And the adolescent will actually try and control the parent or actually be controlled by the parent, so either or, because they are fused. So if we look at the developmental line, an infant is fused with the primary caregiver, and that's okay. That is needed in order to survive. A toddler, they have puppet relationships with their parents, and that is okay as well. But it's often they magically believe that their parents will serve them what they need, and if they don't, they will have a fit. So a school child actually still has puppet relationships with the adult figures in their life, but the puppet figures turn to be they're there to provide for them in practical ways. So what we're looking for when we cross the line is that the adolescent is beginning to grasp the other person as having a separate self, and they're able to make requests and not demands of the other. So where do we see this at the school? Usually at the first phone call when they call their parents. Sometimes the child will just be angry at their parents, or sometimes they'll be demanding that their parents bring them certain things so that they're happy. So you can see where the adolescent may be regressed to. But what we like to see is that when an adolescent is able to recognize that the parent is separate, has another life going on, has different hopes and dreams of what's going on, and is able to recognize that. I see this often when I come into work at school in the morning. A child may often say to me, Victoria, will you please sign my checklist? So again, they're seeing me as a puppet to practically meet their needs. But if they say, hey, Victoria, how was your weekend? They're recognizing I'm separate and I have a life. So the next developmental line that we're looking at is empathy. In order to have empathy, you would need to be able to step outside of yourself and see the other person as separate and step into their shoes. So you have to have some sense of thought, some sense of separateness. So infants aren't able to do empathy. Toddlers, they're self-focused and they're entitled to this. And so there's no real amounts of empathy. School kids, they will have mirror or pseudo-empathy. They will have empathy for people that are just like them, okay? People that are similar. They have a hard time grasping empathy for differences. And that's where adolescents come in. They can really have true empathy for differences. You'll often see bullying behavior in school kids because they don't have true empathy. They will have their clique, their group, but anything outside of that group or anyone outside of their group is not comfortable for them, and they don't grasp what it's like. So there will be bullying behavior. So true empathy is what we're seeking. Next one is the ability to manage anxiety. This is so key to why kids use drugs and alcohol. And because we all feel feelings all the time. So if we look at the developmental line, when an infant feels something, they cry out. They scream, they yell, and they look to others, the adults, to soothe them. Toddlers, again, when they're upset, they're looking outside of themselves to soothe them. Or they might have a blankie or a favorite stuffed animal, but they're not taking care of themselves. They're not able to say, hey, I'm angry or I'm hurt. They're just actually looking for something outside of themselves. Often what our adolescents that use drugs and alcohol, they're just wanting something outside of themselves to soothe them. School kids, they start to learn how to self-soothe, and where they learn is by watching parents and watching social media. And so I have a great example from my own childhood. My brother, who was very, very, loved the Incredible Hulk. And so whenever he saw the Incredible Hulk get angry, he saw how the Incredible Hulk would flip tables. And so one Sunday afternoon when we were playing chess with my family and he lost, he would actually start to flip the table. And he learned that actually by watching it on television. My dad quickly curbed that behavior. And so, but what we're looking for in the developmental line with adolescents is that they're able to name their emotions, and they're able to identify what they're feeling in the moment, and look for ways to soothe themselves with that. So they might say, hey, I'm feeling hurt, I'm feeling sad, I need to take a walk, or hey, I need to talk to you. So they're able to identify in the moment what's going on to calm their feelings. Last one is the developmental line of ethics. Ethics is why we behave. So, and we behave because of how, so why we behave a certain way. Infants, in order to have a sense of ethics, you need to have some thoughts. So infants don't have that. Toddlers, why they behave is actually to avoid punishment. They don't like the word no, okay, and then they will behave to kind of follow that. School kids, they behave to win the gold sticker or the rewards. And what we're looking for the adolescents is why they behave is because of how it impacts their relationship with themselves as well as their relationship with others. So we're looking for a less narcissistic approach and to more of a social ethic. So where do I see this? I see this often when kids will behave in one way in front of staff and another way behind closed doors. Okay, so that is kind of, they're behaving in order to avoid punishment. Okay. Or they're behaving to or performing for us so they get the approval or the next stage. So, but what we really want is when I had a kid say, you know, I really don't want to cheat on my girlfriend because I don't like how it makes me feel inside. And I don't want to hurt another person. That's a social ethic that we're after. So this maturity is to recognize that it's like a gear shift. We can all grow to having adolescent maturity or adult maturity. We hope we do, but we never stay in full maturity. So we will slip back sometimes to behaving like a toddler and a school child. But what happens when kids are really engaged in risky behavior or need to be in a treatment program like us is that they have not matured past the toddler or the school child. They have not reached the adolescence. So example of this would be, I would like to think that I'm pretty mature. However, when I'm driving down the road and speeding and I see a cop car, I slam on the brakes. Why am I doing that? I'm avoiding punishment. So I probably slip back into the toddler behavior at that time. So the developmental model is based on two things. First, you need the neuropsychological readiness to be there, and you need the apt experience. And those two things combined will get the next step of growing up. One without the other doesn't happen. If you have an infant that is maybe a day old and you have parents trying to get them to speak, they won't be able to speak because they don't have the neuropsychological readiness. However, if you have an infant that is maybe a year and a half old, and the parents are deaf and not speaking, they will be delayed in their ability to speak themselves. So in this model, we recognize that there's obstacles to maturation that get in the way of a child growing, and the obstacles to the neuropsychological readiness would be ADHD or nonverbal learning disability or learning disabilities, fetal alcohol syndrome, trauma, head injury. Other obstacles to maturation that affect experience would be a very conflictual divorce. When parents are going through a very conflictual divorce, their eye is off the ball. They're not focused on parenting their kids. Adoption. If a child is adopted, even at 1 day old, there is a rupture in their apt experience. Death of a parent, trauma, addicted or ill parent, or multiple moves. Those are all things that will get in the way of providing an apt experience for a child. So the delay model recognizes that you need, there may be an obstacle to the brain readiness as well as the disruption of parenting. And when there's either obstacles in those areas, you'll see a delay syndrome. And the syndrome will be the global collapse that we talked about. So we have the defective approach of adolescents that have a magical sense of time, lack of separateness. They're seeing people as their puppets, no empathy for others, and not able to manage their anxiety, and their social ethics are really all about avoiding punishment or getting or performing. So our goal is to get kids unstuck so that they have a future orientation that's based on reality. They're able to be separate and see other people as having a self, have empathy for others, able to manage their anxiety, and they have an ethical stance that impacts, they recognize that their behavior impacts others. So how do we get this? How do we get adolescents to grow up and to get more of the mature stance? And we would say it really comes from good parenting. You get maturity through good parenting, and often what parents do is not good parenting. Unfortunately, it's often, good parenting is often rare, and it is something that you really have to be intentional about it. And so Scott Peck, the author of The Road Less Traveled, recognized that good parenting is focused on anything that helps a child mature in a spiritual development way, and not in a religious sense, but really helping a child mature. So there are two key parental tasks that are needed in order to get a child to mature. The first one is accurate recognition, and the next one is limit setting. Both are needed together. We will focus on accurate recognition not because it's more important, but actually it is needed in order to set limits. If you don't have that recognition or that connection with the child and you just start to set limits, you'll be another authority figure like the police that they can write off. So both are needed to do. Recognition. So what is recognition? We all need to be known. Recognition is an act. It is actually stating a predicament that a child is going through, grasping it, and then stating it. A report card is just a piece of paper until someone names it and says and identifies what is going on. We need recognition all our lives. I think back to when I was working, or I was on a family vacation, and my niece, who was 3 years old, was just learning how to swim. She was screaming, Aunt Victoria, look at me, see me, watch me. And then my nephew, who was 16, also needed it, but was not as vocal. If you look to a time when you were recognized at work, pay attention to how that made you feel. Also pay attention to when people were not paying attention or misrecognized you at work. How did that feel? So a shortage of recognition will leave a child weakened. They won't have a sense of self. They will not know who they are. Their sense of self-esteem will be low, and they will have no sense of purpose. So I have an example when I was working at Montana, and I had a father said, my daughter just needs her self-esteem built up. And I was like, that's wonderful. What I need, though, is for you to come here and help me do it. She needs you to write letters, she needs you to pay attention, and you to really grasp at what she's going through. There is not a pill that will fix self-esteem except for your attention. So recognition is really hard to do well. In order to do that, you really need to be self-aware. And you need to have informed empathy and tons of practice. Misrecognition are oftentimes when parents are inaccurate, and it's due to them being bound to their own agendas. So example of this would be, and this is something my own mother and I have worked through, is when I moved to Canada, she saw that as rejection of her. And I was like, rather than seeing, wow, you took a risk, you moved, changed countries, and you're, you're living, 10 hours away from us. And so, so she was bound to kind of missing me rather than seeing the opportunity that I was going through. So what gets in the way of providing accurate recognition is often if we're busy, we don't have time. If we've never had anyone really truly recognize us, it's hard to give recognition when you don't know. Another thing that gets in the way is if you have guilt. or if you're parenting in a divorce and you're focused on the divorce, it will get in the way. Or if you have your own psychological difficulties. So, how to recognize. In order to recognize, you have to be really intentional. You have to make the time to do it. You have to be there. You need a separate sense of self in order for you to see the child as being separate. So you have to take off your worldview and put on their worldview. Recognize that you're separate and that you're the adults. You have to speak with true empathy and be congruent. Recognition is not just being a cheerleader. I had this example when I was working with a young boy, and he was playing tennis, and he lost miserably in a match, and his mother was just clapping and praising him. And the young boy yelled at his mother through the racket after the match, and she was so confused. Why? She goes, I was doing everything, I was supporting him, but it was his anger was because of the misrecognition. So in order to do recognition, time, invest the time, it will pay off. So examples of what recognition will sound like is, so what I'm hearing you say, do I have this right? I want to understand. Help me understand what you're feeling. What I'm seeing is this seems like it's really upset, but I want that you're really upset by this, but I want to check this out. Those comments are showing that you're separate, you're seeing the child is separate from you too, and you're curious and want to understand what their experience is. So, if you just give full recognition without limit setting, you will have a child that has still not grown up. Limits are really important. And why do we have limits? We have limits because we start off all immature and selfish. We are born without empathy. We want what we want when we want it. And it's very cute when we're 2, but it's not cute when we're 16 or 18. Limits confront obnoxious behavior of me first. They draw a line, they hold a standard, and they refuse to rescue. Limits are so needed. So what do limits do? First and foremost, they challenge narcissism in immature adolescents. They create a container of what is safe, and the container actually will grow and expand as the child's maturity grows. So if a child is growing and showing maturity, then the container gets larger. But if a child is showing immaturity, the container gets smaller. And actually, this will relieve a lot of anxiety for the child. So it pushes a teen a limit of saying no, knock it off. It pushes a teen to reorganize the way they see the world and rethink how they approach a problem and or relationship. So I think of a time when I had a limit set with me, and this was with my riding coach and someone that I really valued, had a close relationship with. And she saw how I treated my dad, how I was pretty sassy with him about something he was doing. And my riding coach said to me, Victoria, what are you doing? You know, do you treat your father that way? And she was someone I valued so much that when she said that, I was like, it stunned me, and I really had to rethink, how am I treating my father? So it was a great lesson for me. So what limits also do is they make teens pretty frustrated and dysphoric. You will not get a thank you for setting a limit. Not get a thank you at this time, maybe 2 months later. So guaranteed your teen will be grumpy when you set a limit. So how do you set a limit? How do you say no? It takes a lot of thought and a lot of patience and a lot of practice. I'm still working on it. You have to set limits within a relationship. The number one thing when I set limits is I insist on basic courtesy. If there's any sense of rudeness, we don't even start having a conversation. So I don't make it my problem. I stay in the adult mind, and I make it a problem for a child that they have to figure it out. I accept that they're going to be unhappy, okay? And if I am co-parenting, I make sure I am working well with my partner. Or if I'm in a relationship or if we work with so many families that have divorced families, the families that are able to work together, whether they're divorced or not, are the ones where their kids do the best. Pick your battles. I choose when an issue of safety is addressed. That's when I'll set a limit. I do not fight over what color shoes they're wearing that day if it matches their outfit. Timing is also important. Okay, I do not, set a limit in front of other people or their peers. I look for a time that it's going to make sense. I'm attuned to the relationship. So, and I fit the consequence to the occasion. I do not overreact. So the anatomy of a set limit, I put privileges in a proper sequence. If your homework's done, then you can watch television. Okay, life stops when there's an issue of safety. And then I'm also focusing on making sure that there is a relationship. I pay attention to family resources. Cell phones are a privilege. They're not a necessity. Okay, so with setting a limit, I basically use the Goldilocks prescription. Not too much, not too little, but just the right amount. And for each kid, that's going to be different. Examples of setting limits. If there is a missed curfew, then there's no outing the next night or the next time that there is an outing. Or if they missed it by just a few minutes, then the next outing is shortened. Again, I said this before, cell phones are a privilege. School attendance, absolutely, that is needed if there is ever going to be a privilege or a special, resource given. And also, homework must be completed first, and then screen time, a fixed amount of screen time. So some parents are reluctant to set limits. Often we find parents have a hard time doing this because it is hard. Kids don't like it, and parents have a hard time feeling their kid being grumpy. It takes time. It's not easy to do, and they may not have the skill to do it. Some parents are not convinced that limits are necessary. Or they may feel too much shame or guilt from what's going on in their own lives that they have a hard time with the limits. So in summary, if we want to help an adolescent grow up, we need to make time, pay attention, and recognize. Build that relationship, keep the container one that expands as the child matures. Insist on basic courtesy, hang together in the parenting. In the limit setting, use proper sequencing. Also use resource removal as necessary. Parent authority relies on that emotional bond, so invest your time in it. Both limits and recognition are needed at the same time. In fact, if you are doing accurate recognition, you will recognize when a limit is needed. So, last slide, maturity is possible. And it's possible with intentional good parenting sustained over time.